run anymore later. So this session is going to be on MMIs. So basically what we're going to cover is what multiple mini interviews are and what kind of questions come up. I think last week I went over what questions come up in general for both panel and MMIs, but for MMIs I'm going to go into more specifics today. So a little bit about 6Med. It was created by medical students for medical students, and we've taught a lot of students in the past 6 years. And the kind of events we run are these surgery webinars, which happens every Sunday, 2 to 3 p.m. And they will tend to run all the way on until December. I don't know what's happening after December, but all the way until December, every Sunday we do have these sessions going on. We also offer UCAT and BMAT support, so that's one-to-one, or in the summer we also run big online courses where you can like come for the day and learn everything about UCAT. And then we offer one-to-one personal statement support as well. And then we do interview prep, which is going on now, where we do large MMI courses or interview courses. And I'll be teaching a few of those. So if you want to come along to that, you can do as well. And you do have to pay for that though. So just have a look on the 6Med website for that. So a little bit about me. I'm a 4th year Bristol medical student. I just finished my intercalation and I've gone back into medicine, and I'm quite passionate about teaching. So the things we're going to cover today is just trying to understand what MMIs are, trying to understand the difference between MMI and panel interviews, and try and prepare for your upcoming MMIs. And I'll finish off with some top tips based on my own experience as well. So just some things before we start. So make sure your mics are muted during the session. And also I'll try to make the session as interactive as possible. So any questions I ask, if you guys can type the answers into the chat, and also try and post questions during the session into the Q&A function. And then I'll try and answer them at the end during the Q&A bit, or I'll try and answer them as we go along, depending on how relevant the question is. So before we start, on a scale of 1 to 4, how do you guys feel about medical interviews, with 1 being not confident at all and 4 being really confident? Okay, so lots of people between 1s and 2s. Okay, fair enough. So hopefully that will change by the end of the session. So the main aims are to try and understand how MMIs run, and then how to prepare for the MMIs as well. So what is an MMI? Does anybody know? If you can type your answers in the chat box, please. Yeah, so multiple mini interviews, most of you have got, and then you've said 8 to 10 stations. They're short 5 to 10 minutes interviews, and a new scenario and interviewer every time. Yeah, correct. So most of you are kind of familiar with what they are already. So yeah, good. I think all of your answers were correct. So they're multiple mini interviews, and they can be anywhere between 7 to 10 stations, which cover various medical topics. And in recent years, because of COVID, the platform has also been adapted to be online, but mainly it's a face-to-face interview. And I think a lot of universities are going back to a face-to-face setting now. So which universities use the MMI format? Well, it varies year on year. This was taken from, last year's cohort. So don't I'd say take this slide with a pinch of salt, because it might change slightly this year and then next year as well, because universities are constantly changing the way in which they do things. So it might be panel interviews 1 year and MMIs another year, but in general, in the last few years, these are the list of universities which have used an MMI format. I applied to basically all MMI format in universities, which was by chance. So I applied to Bristol, Cardiff, King's and St George's. So all 4 of my options were MMIs. I know some people had a mixture of panel, traditional interviews, as well as MMIs, and some of them also had group interviews in my year, in the year that we were applying. So there's a mix of different things you can get. So what's the difference between MMI and panel interviews? Does anyone know? If you guys can type it in the chat. MMI has stations, different people each time, has role play. Is panel one big interview? And then, so Hafsa, you said less chance to mess up with a panel. I would say actually less chance to mess up in an MMI because you have so many different interviewers that say if you did badly in one interview, you can always pick yourself up in the next station. So yeah, a panel of up to 4 people asking a series of questions, MMI, multiple short stations. Yeah, good. I think all of you get the gist. So with MMI versus panel, so the things that are similar between both types of interviews are the types of questions they cover. So they'll give you marks on your motivation for medicine, so how passionate you sound when you speak about medicine and what have you done to try and understand about a medical career. It'd also be stuff on like knowledge of the medical school itself, so make sure you do your research about the university that you're interviewing for. Your work-life balance, how you maintain a good work-life balance and manage your stress. If you know enough about current NHS topics, that's tested in both MMI and panel. And then lastly, body language. A lot of people forget about this last point, but it is something that does get you a lot of marks, and it also makes you makes the interviewer have a positive impression of you, because if you're quite closed off and you don't really look like you want to be there, they're less likely to give you a place because they just see that as you're not motivated enough and you're just doing the interview for the sake of doing the interview. So although people don't put as much importance on body language when they're interviewing, the interviewers do look out for it a lot. So making sure you have open body language, making sure you're making eye contact, changing the tone of your voice, like sounding interested, sounding like you want to be there, and that will naturally come across if you're enthusiastic about studying medicine anyway. So it's not something that you have to force yourself to put on. It's just things like eye contact can be a bit difficult when you're nervous anyway. So just making sure that you're a bit more aware of making eye contact with the interviewers. That doesn't mean like constantly staring at them directly, just making sure that, you know, naturally you just look at their eyes and you like nod and answer their questions appropriately. Okay. How to research the uni medical school, like the subject and structure, it will be on their website. So all you need to do is have a look on their website. They have everything that you need to know on there, which is why they expect you to know it. How do you update with current affairs? That should be on the 6med website. It's also on other websites like the Medic portal, BBC News, the health section of it all has updated information. How long is the webinar? Should be an hour, approximately. So the unique features of the MMI itself, we have things like role play, which we normally don't have in a panel interview. We have a bit of problem solving, so they could give you a scenario and they would ask you, how would you solve this issue? You have multiple interviews, like someone else said, so you have multiple chances to impress different people and try and increase your score. It's usually 5 to 7 minutes per station rather than a 30-minute long interview with the same interviewers, which is what a panel interview would be. Normally your examiners have not read your personal statement with multiple mini interviews because there's just way too many of you that they're interviewing and they can't remember all of you. Whereas in panel, they're more likely to have your personal statement with them, but not in all cases. But in MMIs, they're less likely to have your personal statement. So when you're giving your examples, feel free to, you know, use the examples you've given in your personal statement. That's kind of the whole point of writing the personal statement, using that as a basis for your interview, but also expanding on other examples that you haven't included in your personal statement or didn't have the opportunity to because you didn't have enough characters. So there seems to be a question in the chat. Is it a bit late to start preparing for interviews now? Nope. So I started preparing probably end of October, beginning of November. I had my first interview, which was at Bristol mid-November. So honestly, I just try your best to, like, you know, keep the preparation sort of constant. Doesn't matter when you start, just make sure you approximately now would be a good time. So then, you know, you're familiar with the kind of topics they'll ask you. So how do you actually prepare for an MMI? Well, as I said before, reading up on current NHS topics, I did go over a lot of current NHS topics in last week's surgery. So you guys can have a look at the recording on that on the 6med website. And if people have attended that, they will know as well. Make sure you read your personal statement 1 or 2 nights before your interview, because it helps refresh your memory on what you wrote then. And it will help you just come up with answers about, you know, some examples that you remember that you wrote in your personal statement, but you've forgotten about it. It'll try and re-jog your memory so that you can include those examples. Practice role play. So this is something I found really difficult, because role play is something that just seems very artificial, and like having to, you know, comfort someone like a fake patient about, you know, if they're being upset or if they're feeling upset about something, is something that you normally have not done in school. And it's just a very weird scenario to be in. But all they're testing you on in role play is your communication skills and your ability to sort of empathize and understand the emotions of the other person. So if they're very angry, or one thing you have to do is like be prepared for any type of reaction. So if you're breaking bad news to the actor or who's pretending to the patient, you can expect them to either cry, be sad about it, not really be bothered at all, or they can get very angry depending on, you know, what the situation is. Be prepared for all types, and regardless of how they react, you need to give them time. So using a lot of pauses and silences, and also asking them, can you do anything else for them? Is there anything else you can do to support them? So making sure to use their empathy side of things, even though you might not know what to do medically, is what they're looking for. And then watch your body language, as I've already mentioned before. Where can we get scenarios from? I think you can find a lot of scenarios online. So if you just type in MMI role play scenarios, you should be able to find them there. Important topics that come up, same as your panel interviews, are like motivation for medicine. So why do you want to study medicine? So all of these questions I've gone through really in depth in the last session. So again, as I said, have a look at the recording if you weren't able to attend that session. Because I went through how to actually answer each of these questions. So a motivation for medicine is things like, why do you want to study medicine? Knowledge of the medical school is like, why would you like to study at this specific medical school? Structure of the NHS, so they might ask you things about like secondary care, primary care, tertiary care, how they all interlink, what are clinical commissioning groups, what is the Care Quality Commission. So those are basic things you should really know before your interview. So primary care is obviously GP, secondary care is hospital, tertiary care is like specialist centres, which, you know, specialise in specific niche things for people with rare diseases or stuff like that, or rare cancers, and they're like the treatment centres for that. The CCGs is something called clinical commissioning groups, and they're a group of loads of local GPs who basically get together once a month or once every few weeks, and they look at the statistics of the patients who come into their practice, and say, for example, in a certain area in the UK, if a lot of people have heart health issues, then they will try and allocate their funding to help that specific cohort, because that's the majority of their cohort, if you see what I mean. So stuff like that. So have a read of that online. You can find that very easily on the internet. And CQC, or Care Quality Commission, are similar to like Ofsted in schools. So they're independent bodies, and they come into hospitals, and they just check that things are running the way they should be running, and there's no foul play, or like, you know, the care is equal across the country. So that's what they're trying to look at, because obviously, as we know, one of the main policies of the NHS is free care for all and equal care for everyone. So it's just to try and maintain that standard. Current NHS problems, as I mentioned, you can find lots of that information on BBC News website. You can find it on the 6med website, and you can also find it on the Medic portal. So have a look at those. In the MATS MMI section, our communication skills looked at. I don't really know what a MATS MMI station is, so if you can try and elaborate on that, and then I'll try and answer your question. How do you access recordings? I think if you go onto the 6med website, scroll all the way to the bottom where it says 6med surgeries, click on that, and you should be able to access previous recordings. So tips for the actual interview day, make sure you read the recent news. So if recently there's been things like, progress in HIV medication and things like that, make sure to look into that. There's also been stuff on abortion in America and how that might impact the laws in the UK. And there's a lot of like turbulence as to whether the UK law on abortion is going to change or not. So that might be something that comes up in your interview. As I said before, make sure you research the medical school. A lot of the information that you need to know is on their website, so you don't really need to look anywhere else. When you have a bad station in an MMI interview, make sure you don't dwell on it. Make sure you forget about having that bad station and move on quickly to the next one. And then make sure you make a good first impression with every interviewer. So that can be done very easily, like just saying, hello, my name is, shaking their hand. Not all interviewers will want to shake your hand, but it's just good to offer, because that's just how you would meet anyone formally. And making good eye contact, making sure you smile, having that open body language can all help with making that good first impression. And dress smart as well. So whether it's an online interview or whether it's a face-to-face interview, you would dress the same. So for boys, like smart shirt, trousers. For girls, it's like smart top, smart skirt. If you want, a few people wore blazers, but that's up to you. It depends also how you normally dress in sixth form or at school. So yeah, up to you guys. But just make sure it's like a job interview basically. So make sure you dress appropriately. Any particular books you recommend reading prior to the interviews? To be honest, I didn't really do any wider reading. My wider reading was more like reading online articles, like on recent topics. So I think at that time Bristol was doing a lot of research on, I can't remember, it was like cancer therapies. So I read up a little bit on that, and I then talked about that, because that's also quite impressive, because then you're looking at what the university itself is doing their research on, and then you're speaking to them about it. And obviously, because it's their university, some people who are the interviewers might know a lot about it, because they might be one of the researchers. So they might just be able to see that you've, gauged a lot of interest in that university specifically. So that was the last slide. So this is a very short sort of whistle-stop tour about MMIs. What I mostly wanted to spend time on was just, if you guys had any questions about my experience of MMIs, for me to go through that instead of trying and going through questions with you. I think that's the best way to learn. So sort of just trying to see from my perspective how it was for me. And you can ask me any questions you like. So those were all the slides I had for today, because most of the content I covered in last week's session. So start posting your questions about MMIs, or if there's anything about specific schools, feel free to let me know about that in the chat. Any unusual stations you experience? That's a really good question. So one of the things I got in my interview was like, by 2050, there will be a 50% increase in the number of flights. So how is that going to affect the NHS or the healthcare system? And I think the main things, I found that a little bit difficult, because it was a bit, niche. So I spoke about things like, well, it might increase the amount of air pollution, respiratory illnesses, which might then impact on the NHS, but it might also improve our research, because if we have more flights, then we probably have more access, because we can easily travel to other countries for a cheaper price, because the flights are just more available and there are more of them. So in that sense, we might be able to go to international conferences as doctors, and we will be able to more easily share research with international people, and also present our own research and learn from each other. So that's a good thing. Another thing is people with really rare diseases will be able to easily travel to get healthcare in different countries. Especially if they need to go to specific tertiary or quaternary centres, which are not available in the UK. They might be able to go to those a bit easier. So that was the kind of answer I gave. It is a little bit niche, and I did struggle with that question, but I seem to had done okay in that station. I don't think I was too bad. Did you mess up on any station? If so, how did you get over it? So there was one station in Cardiff. Of course I messed up. I think everyone does, 1 or 2 stations. You know, it's just when you're under high stress situation, you can mess up. In Cardiff there was a station where they gave us like a booklet of maths questions, which was similar to what you guys would have done for the quantitative reasoning section of your UCAT. And basically what we had to do is do all of those maths questions. There are about 10 of them in 3 minutes or something ridiculous like that. And I think 1 or 2 of the questions I just completely just left it to the end, and then I didn't have enough time. I was rushing, and I think I messed up with a different question, and I just didn't manage to finish all of them in time. And that, I think, really sort of, you know, put me down a bit as soon as that station ended. But what I did was you get 1 minute of reading time before you move on to the next station, so that you know what they're going to ask you or what the theme is of the next station, so you can mentally prepare yourself. In that 1 minute reading time, I just sort of try to calm myself down and try to not think about that station and forget about it, which in a way really helped, because that one bad station didn't affect like the rest of my performance in the other stations. For medical ethics questions, do you come up with a conclusion? Normally, yeah, they would expect you to come up with a conclusion. They don't expect you to know exactly what to do, because with ethics, there's no right or wrong question as long as you're able to justify the answer you give. Sometimes it is okay to sit on the fence. So for things like euthanasia, which is a really difficult topic, and people really higher up are still like, you know, debating on the issues surrounding euthanasia, you don't have to come up with a conclusion in that case. You can say this is a very difficult scenario, but if it were me or if it were my relative, this is how I would approach it. So you can sort of twist it like that. And yeah, as long as you demonstrate that you know the ethical principles and you put them to use in the scenario they give you, it's fine. How did you train yourself to handle the role play sections? I tried to practice with lots of different people. So there was a teacher at my school who was really good with sort of helping with medical school interviews, because she helped a few students in the year before me. So she was quite helpful, like, you know, practicing role play with me. I also practiced with parents and like siblings. So having different people and practicing with them is useful, because different people will take on the scenario in different ways. And it's like how you would deal with like different patients in real life. So it's just useful to practice those skills. And ask them to give you feedback, because again, different people will pick up on different things. What is a quaternary centre? It's one above a tertiary centre. It's just a really, really specialised centre where they only do specific procedures for very rare diseases. How many MMI stations are there? Typically around 7 to 10, 5 to 10, depends on the uni. Did you ever have to interpret any graphs or diagrams? I did. It wasn't graphs or diagrams. It was more, we got given a picture of a skin lesion on someone's hand, and it was just a picture of the hand with a skin lesion on it. And what we had to do was describe the picture as if we were a doctor and we were writing a report about that picture. And then at the end, we were given instructions to sign and date it as if we were a doctor writing the medical notes. And that was in Bristol. And I would just say, make sure you like mention the most obvious things first. So just say, this is a picture of an elderly person. We don't know the age and we don't know the gender, so that is something I would ask later on. And then you could say, like, there's a 5 centimeter lesion on the near the thumb or something like that. Just be very specific, like make sure you know the location, how big the lesion is, where it is, and what it looks like. Does it look dark? Is there like 2 different colors going on there? Is there any bleeding? Does it look like that person has itched around the lesion? Basically, just, you know, if you were going to go into a GP and if you had a skin lesion on your hand, and if they asked you to describe it, how would you describe it to the GP? Similarly, that's what you need, how you need to describe it and write it down in that interview setting. So that was a bit of a weird question I got. What is a lesion? It's just like anything that's like something on your skin, basically, which shouldn't be there. That's what a lesion is. I don't really know how else to describe it. How did you practice the role play sections? I've already answered that one. What did I get in my UCAT? It's been about 5 years now since I did the UCAT. I did mine in 2017, so it's been a while. I think it was something in the 2700s or 2800s. I can't remember exactly, but it was enough for me to get into Bristol / Cardiff. So I can't remember exactly. But obviously now I think the cutoff scores have gone even higher than that. So it is harder for you guys to get in, but I mean, all you can do is try your best. And I know the UCAT has been really difficult this year, like the cutoff scores and things like that. So yeah, how do you answer why not nursing questions without messing up and being offensive? Just acknowledge that nurses do a lot of work for patients. In fact, they probably spend more time with the patients than doctors do. And there are some advanced nurse practitioners who do have similar amounts of knowledge to a doctor, but one thing they can't do is, like, you know, being the knowing like enough to make diagnoses. Well, some of them do, who are the advanced nurse practitioners, but they're in like specific specialties, they don't have an overarching knowledge of all different types of conditions. And I think the other kind of things that doctors do is also like procedures, so like surgeries and things like that, if you're a surgeon. So just making sure to distinguish that. It is harder to distinguish nowadays because nurses are able to do a lot more than you know, in the past 30, 40 years. So I would have a read online, but just making sure the way you can not be offensive is by acknowledging how much they do, and but doctors do have like an overarching opinion about what needs to be done, and that's kind of the thing I want to be involved in rather than nursing. How different were the MMIs between medical schools? They weren't that different, if I'm going to be completely honest. Most of the questions they ask are the same, like why medicine, why this medical school, what do you do in your free time, what have you done in your work experience? All of those are standard questions which will be asked everywhere, which is why they're really easy to prepare for. But the different ones are like the niche ones, like I said, where they asked about a skin lesion, or in Cardiff where they asked about like, you know, doing maths questions in like 2 minutes and stuff like that. Or that niche question about by 2050 there'll be an increase in the number of flights. So it's like the scenario, the role play questions would slightly differ, but they're all testing the same skills. It's just they're asking it in different questions. What uni did you go for an interview? How did it go? What did you find? So as I said, so Bristol, Cardiff, King's and St George's, they were all quite similar in terms of the interview format because as I said, they were all MMIs. So the kind of questions they can ask are pretty similar. That it's just the way they ask it will be different. I definitely think Bristol went a little bit better than Cardiff, but Bristol was my first interview, so I was the most nervous for that one, whereas Cardiff I felt a little bit more confident, but I think the maths questions and things like that threw me off a little bit. How do you answer the question that's like, what would you do if you don't get in? Well, I think you just need to answer it as confidently as you can. Well, if you don't get in this time, you really need to think about what you're going to do next time. Are you actually going to give medicine another go, or you just need to be honest? Or are you going to try and do biomedical sciences and then get into medicine afterwards? Or are you going to take a gap year, do a little bit more work experience around medicine, really see if this is the right fit for you, and also contact the universities to ask them where you went wrong so you can improve that in the future. Those are the kind of answers I'd say. So, but you need to think about what you want to do. The last thing they want to hear is like you guys saying something just for the sake of saying it. Just make sure you're really genuine about it and you'll be fine with those questions. They just want to know to see if you have a backup plan. And they want to see what is the extent of your motivation for medicine, basically. How do you answer, how do you maintain a good work-life balance? That question is basically asking you, what are your hobbies? What do you do outside of academics to keep you, not stressed? And you just talk about your hobbies, and then you can say, I do this in my free time so that I don't get too worked up about academics, and this is how I've been managing an A-levels, and this is what I'm going to be doing when I get into medicine as well, so that I maintain a good work-life balance, because I know how stressful the career is. So yeah, that's kind of what they're asking me to say there. Is there any more hot topics you have currently on the news? Can't think of anything off the top of my head. I guess the one main thing is like there's an A&E and GP crisis which has been going on for a few years, where there's just not enough staff and not enough money for the A&E and for GPs, but there's an overload of people coming in with health issues, and both GPs and the A&E just can't seem to manage that workload. And it's putting such a demand on the NHS, and a lot of people are leaving the NHS as well because of Brexit, and also because of dissatisfaction in the job. So I think just talking about that, because that's quite relevant at the moment. And obviously there's the nursing strikes, there's the scandal with Lucy Letby and in the neonatal ward, so that's a very current issue, and stuff like that. And things like the postcode lottery and all that. So have a look online. How much notice did your unis give you before your interviews? Bristol was quite short notice. They gave me the interview offer in, when was it? In the first week of November, and I had to book my interview for the third week of November. So I didn't really have that much time. But Cardiff, I got the interview offer in mid-November, and I was able to either book a date in December or in January. I personally wanted to get my interviews done before Christmas, so I booked it for December. But some people prefer having them quite spread apart because they might have mock exams and things like that in like before Christmas, so they would prefer to do it in January. But I had my mocks in January, so that's why I preferred to have done it in December. So it's up to you. Anything topical which could be asked to do with the NHS, which could potentially be asked in an MMI. So the things I just mentioned now. Did you ever have to interpret any class diagrams? Yes, I did. I think it was in the Cardiff interview. Were the MMIs of different universities very different from each other? I've answered that one. Any hot topics? So the kind of stuff I talked about, like Lucy Letby, euthanasia, abortion, those kinds of stuff are really popular at the moment. NHS strikes, is strikes ethical? Things like that. They'll ask you stuff like that. How did you approach the why medicine and why become a doctor question? It's basically like the first paragraph of your personal statement that you've written, because that's answering the same question. You just need to be genuine. Mine was, I initially really liked biology and learning about the cardiovascular system and the renal systems of the kidneys and how everything interlinks. And because I was interested in that in year 11, I then went and did some work experience where in secondary care and in primary care, where I observed what a GP does and then observed what people did in a hospital. I was in the obs and gynae unit, so I saw, pregnant women and people, the babies in the NICU, the neonatal unit and things like that. So I just learned a lot about how the system runs, basically, like the teams within healthcare runs, and how everyone works in a multidisciplinary team. And I just liked putting that knowledge that I had into practice to help people. So that was my main reason. And then I talked about like my specific work experience examples, what I observed, what I learned from that, what skills I gained from it, and how I would use that in order to become a good doctor. And that's how I answered the question. How long do I ideally recommend preparing for MMIs a day? Maybe 1 to 2 hours. I wouldn't spend like ages doing it. It's just try and take it as something that you're just doing. Try and make it like a fun activity. Don't make it like another form of revision, because you already have your A-levels, which you might be stressing out about. So don't try and make this like really stressful for yourself. It is obviously stressful because it's something that a lot of you may not have done before, and it is high stakes because it's to get into medicine, and it determines a lot about your future career, which I completely understand. But try not to put too much pressure on yourself. So just 1 to 2 hours a day should be okay. But if you find you're really lagging behind, try and maybe increase that to 2.5 hours, but make sure you break up those hours, like do 1 hour in the morning, 1 hour in the evening, something like that. How much notice did you use? Oh, yeah, answered that one. Do you have to introduce yourself and role play stations? Well, yeah, so they will tell you who you're going to be playing in the role play. So they may say, you are a medical student in this scenario, you have a patient who's dot, dot, dot. And then, so you'll introduce yourself as, hi, my name is, so for me, it'll be, hi, my name is Shruti, I'm a third-year medical student. Can I just confirm your name and date of birth, and then go from there, because that's how you start an introduction with any patient. How did you answer? Yeah, I'll answer that one. Were there any other unusual questions you were asked which you hadn't thought about before your interview? It wasn't an unusual question. It was a question I'd practiced before. It was just one of the solutions I hadn't thought of before. In Bristol, they gave us an ethical scenario about blood transfusions, and they said there's a person, 39-year-old man, who's come in with, he's bleeding a lot and it's an emergency situation, but we found that he's a Jehovah's Witness. What are we going to do for him? And I talked about the ethical aspects of like being a Jehovah's Witness, respecting the patient's autonomy, but also, you know, trying to strike that balance between beneficence and non-maleficence, and making sure that we do treat them in some way so that they don't just die, and we have some sort of alternative for them. And then I said that answer, and it was quite a short answer, and then he was really pushing me, my interviewer, and he was asking, well, is there anything else you can give them? And I said, so one thing, if they're losing blood, they're also losing fluid, so one thing you can give them, and just to stabilize them, is give them fluids and make sure that everything else is okay, so that even though they're losing a bit of blood, they're still sort of, they've got enough volume in their blood, because you're giving them the fluid to try and stabilize them before you decide what to do next. And the other kind of things that we could mention, which I didn't mention and I found out about it later, are things like synthetic blood transfusions, so blood which is basically made in the laboratory, which you can give them because it's not blood from another human being, which is basically why Jehovah's Witnesses don't accept blood transfusions. So you can give them synthetic blood transfusions, which is relatively new. And you can also give them things like other blood products. So it's not blood cells, which is what they don't accept, but you can give them separated products from the blood to still keep them alive. So I can't remember off the top of my head exactly what they are, but if you just type in what can Jehovah's Witnesses have in terms of, you know, blood products, you will find that online. So what is bed blocking? I wouldn't use that term because it's a very derogatory term, and we try to avoid using it in medicine. It's a term used a lot by the media, but it's just very mean saying that about a patient. Essentially where it came from is that elderly people who come in end up staying for really long because they have lots of health conditions, which means that they take longer to recover. But also, if one thing goes downhill for them, then another health problem that they have also starts to go downhill, which means they're staying in hospital for a really long time. So say if they come into hospital because they've fallen and they've had a hip fracture, but then the hip fracture is fixed, and because they're not moving as much, they get a clot in their leg, and then that goes to their lungs and then causes another issue. We solve that, and then another thing happens where they get like a chest infection. We solve that, and then they get really dehydrated, and then they get something else. So it just spirals and spirals and spirals, because elderly people, their bodies, you know, are much slower at fighting off things or recovering. So it just does take them longer. So they're more vulnerable to other health issues whilst in hospital. They end up staying in that bed for longer, which means that other people who might also need that bed don't get the bed. And that's where the term comes from. But I think it's a very horrible term to use about a person, because just because they're old and they have other health problems doesn't mean they're blocking a bed. It almost seems like you're saying that they don't deserve the bed as much as somebody else. So that's why I think it's quite a derogatory term. So I wouldn't use it. I would say the bed issue is a problem, but I wouldn't blame the patient for it, because, you know, everyone has health problems, and if they need the help, they need it. So I think it's a very sort of blamey term, so avoid using that, but that's where it comes from if anybody wants to know. How many offers did you get? So I got 2. So I got Bristol and Cardiff. And the other 2, the London ones, were quite competitive, and I didn't end up getting them, but my top choice was Bristol anyway, so I was happy with that one. How's St. George's interview? Quite similar to the other ones as well. I don't necessarily remember it being vastly different to anything else. Just they do have a few role play stations, so just be wary of that. How did you answer the why medicine? I've already answered the question. How long are the interviews? So each station is about 5 to 6 minutes long. Plus you have 1 minute reading time. So it'll probably be 1.5 hours to 1 hour, 1 hour 40 minutes to 2 hours probably, I'd say, depending on the university. Please can you go back to the hot topics slide? I don't know if I had a hot topic slide. Yeah, no, I don't think I did. I just had one like this, if that's what you mean. This slide. Is there a good website we can visit that can give current news on the NHS? I'm not too sure. I'll try and find out and pass it on to the 6med admin people so they can let you guys know. I haven't heard back from Cardiff or any of my other uni. Should I be concerned? Probably not, because they'll just start giving out offers now. What kind of maths questions were you asked? It was very similar to the quantitative reasoning section of your UCAT. I can't remember off the top of my head. It's been 5 years. But it would be very similar to the kind of problems you get there, like very simple, like conversions and things like that. But when you're under high stress, like time environment, it can be a bit stressful, and they don't give you a calculator. So just be wary about that. But they might have changed that since then. They might not have those maths questions anymore because it's been a while. I've applied to Cardiff Uni. When do they usually tell that I've been accepted? They've written exams side by side with the verbal exam. How did you prepare for the written exam? I think that's something that's been added as a new thing. I didn't have to do that exam, so I'm not too sure about that. I can't give you much advice. But how do you prepare for the written exam, and any general advice for the Cardiff interview which you think can be useful to know? Like I said, just like maybe have a look at your like UCAT stuff about the maths, the quantitative reasoning section of it, because they do sort of ask a few questions from there. But other than that, I would just say prepare like you would for any other interview. Are there any differences between a regular entry or graduate entry MMI? I don't think so. How would you tackle the what is your greatest weakness question? So talk about your weakness, but turn it into a strength, or talk about how you're working on that weakness, so that you're improving on yourself. So if you are quite, how do I put this? If you struggle to keep your time organized, just talk about how you've put in place habits like making sure you have you've planned your day out, and you have you've written down things on a calendar, you've got like a timetable so that you know what you're doing that day and you don't forget and you stay on top of things, that kind of thing. Do you only get asked one question per station? Not necessarily. They will ask you one question, and if they feel like you haven't answered the question fully, they might ask you a follow-up question. I always say to students, try not to let the interviewer ask you a follow-up question, because it's an indicator that you haven't said enough. So even if you're struggling to say a lot, try and take a pause, think about what else you could say, and then carry on answering. Don't just stop after like 2 sentences, because that's not enough for a medicine interview to get an offer. Would you recommend getting a tutor for interviews? Yeah, you could do. So 6med does one-to-one tuition support if that's something you want to do. I personally didn't have one, but some people do find it useful. I've tutored a lot of students through 6med and uni admissions on a one-to-one basis to help them with their interviews. And we spend like an hour per week, and we go through different MMI questions and role plays. And then closer to their interviews, I do like a mock with them. I run it as if it would be like an actual panel or an actual MMI interview. So yeah, if that's something you feel would help, of course, go for that. But I can't have a personal opinion on that. It's up to you and the way you guys learn. What sort of maths level questions do we need to be able to, like GCSE based? Yeah. Are data interpreting questions very common? Also, how should we tackle this? Yeah, they are quite common. Start by looking like as you would for any graph. Look at the x and the y axes, just try and explain what those axes are trying to tell you. And then try and explain what the curve itself is telling you. Usually it's more than one curve, so try and compare the two curves, see what they're telling you. Read off some basic values and try and interpret them so that they can see that you understand what that graph is trying to tell you. A very common question is like insulin, giving insulin after someone's had a meal and seeing their spike. And what you need to do, because you guys do learn about insulin and diabetes in your A levels, they will expect you to put that into context and say, the reason this is happening is because in type 2 diabetes, the pancreas doesn't respond to high blood glucose as not, it would in a normal individual, which is why they don't release insulin, blah, blah, blah. That kind of thing. So you'd need to put it into context. So if it's like basic knowledge that you would know by the time you're in GCSE or A level, they would expect you to put it into context. If they give you a complicated graph, they would just try, they would just, would be seeing that if you can try and guess what the graph could possibly be telling you. In MMI stations, when you know that your colleague is lying, how would you approach this? You'd have to be quite sensitive, and you'd still have to take them into a quiet room, confront them, but not in a way which is quite aggressive, and also like offer support, because there might be a reason why they're lying, so trying to understand that reasoning and things like that. What's the aim for the numeracy question? Like, how accurate is our answer? So I think we've got a bit stuck on the maths side of things. It's not in all universities they do this. It's just in the year that I was interviewing, they did it in Cardiff. I think just show you're working out, because you will get a lot of marks for it, even if you don't get to the answer. Do you have any tips on online interviews? It's hard on online interviews to make a good first impression. I'd say it's harder than face-to-face ones, but looking at the camera, eye contact, smiling, it's the same advice I would give anyone doing a face-to-face interview. It's the same things, but just on top of that, like, make sure that you have like a clean background and you've not got like unprofessional things in the background, like you can't see a bed and things like that. Make sure you're in a quiet environment. Take it as seriously as you would if it was a face-to-face interview. I'm a grad student, maths is not so polished, forgot the ones from UCAT. Any tips? Try your best. It will probably be things like percentages and trying to work out ratios and proportions and stuff like that. So honestly, it is something that doesn't take long to learn again, or like refresh your memory on. But just try your best is what I'd say, and have a look online at some UCAT quantitative reasoning questions if you really want to. A few more questions here. So a few of these I've already answered. Oh, by the way, if everyone's happy with everything else and there's no other questions, feel free to go as well. But for the people who are here, let me just have a look. How long do you think we should dedicate to interview prep? Oh, I've answered that one. Can you walk us through your MMI experiences in general, like easiest or hardest? Easiest station is the question like, why medicine? Why are you applying to this medical school? Because they will ask you that question in every single interview. So you'll be so prepared. You just have to prepare for those. You'll be stupid not to prepare for those questions in advance, because every single university asks them. And the knowledge of the medical school, they expect you to know it to a T, because everything about their medical school and their course and their curriculum is on their website. So if you don't know it well, it just shows that you're not motivated to go to that university. So those things they will expect you to know. Harder stations are role play. Role play was the hardest one I found, because it is hard to get into that state of mind. Some people find it difficult not to laugh, and you just have to try your best to take it as seriously as you can. And yeah, that just comes with practice. Are there differences between regular? I've answered that one. How to prep for data interpretation, maths questions. Do you get asked any one question? I've answered that one as well. Sorry, quite a few overlap questions. What do you think made you stand out at interviews? Not giving generic answers, if I'm going to be completely honest. What I mean by generic answers is things like, I want to study medicine because I love helping people. Everyone's going to say that, but what specifically made you want to study medicine? What sets you apart from everybody else? That's what they want to know. And the only way you can show them that is talking about your personal work experience, because that is personal to you. And your experience will differ from somebody else's experience. So talking about that and how that had an impact on you is what's going to make you stand out, and it's what's going to make interviewers remember you over somebody else. Any advice for online? Yep, let's talk that one. Can they ask why medicine, not physician associate? They could do, yeah, because physician associates can basically do everything that a doctor can do, except not sign a few things, or like, you know, a few legal things they can't do. It's a very valid question that they can ask, but I think you can just say, you know, medicine covers like a vast range of things rather than a certain specialty. Physician associates do also know a lot, and they are quite helpful within the multidisciplinary team. But the reason why I want to be a doctor is to develop those leadership skills and have more of an impact on the multidisciplinary team, or have more of that I don't know, I guess, impact on determining what sort of treatment the patient would like and things like that. Yeah. Is there a good website where we can visit that can give current news on the NHS? I think I mentioned a few already. So 6med, Medic Portal, stuff like that. Are MMIs marked purely on content of answers, also body language and general communication skills? Every station you get marks for communication. Every station you get 1 or 2 marks for body language. So it's not just on the content of your answers, it's also how you appear to them. Because this is the only interview between now and by the time you're in F2. For F1 and F2, you don't have interviews. So this is your interview to become a doctor. So that's why they take it really seriously. I have a group chat which sends news for us to read. Okay. From what month to what month do they usually give out interview offers? It's usually between November to April, because that's when they run the interviews. Some universities take until May to tell you whether or not you have got a place, just because of how many people apply. Do they ask you dose calculation questions? Yes, it's quite common. Just make sure you convert your units, you know, and make sure you like talk through your working out, because they don't really care whether or not you get to the answer at the end. They just care about how your thought process is and whether you can alter it based on whether you think you've got the right answer or not. Because if you try one route and it doesn't work, obviously you have to try a different one, but just showing them that is useful. So they can see that you're using alternative thought processes. Okay, that's just repetition, same questions. Did you have any online interviews? No, because COVID wasn't a thing in 2017, so we didn't have online interviews. All of my interviews were in person. Are you aware of any common data interpretation topics like diabetes? Yeah, diabetes is a big one. Survival curves is common. They're very easy to interpret. They might ask you stuff. Diabetes is the main one, but they could ask you stuff. They could give you 2 graphs about two different drugs and what the price of each of those drugs are, and then like the price per unit, and then you have to work out like how many drugs you need and stuff like that. So that could be a common one as well. Is there like a list of all the things we should learn for the interview? It's in my previous PowerPoint from last week, so have a look at that. In a station, if you have a problem where you see a consultant drink alcohol, would you talk to someone who knows the consultant to go and talk to them? You would go directly to the consultant first. And then if they're quite aggressive towards you, you would then seek help. Could you give an example of where leadership skills is important when you're working in a multidisciplinary team? When you're trying to help the patient understand what's going on with them, you have to take on a leadership role. When you're working in a group as a medical student and you'd have to take on a leadership role to get something done, leadership comes in everywhere. What did you personally say for greatest weakness? I didn't have that question, but I talked about time management, because it's difficult to keep on top of things. So that's when in A levels, I created a timetable and made sure to write everything down so I knew what to do every day. So is what I would pick if I were in your situation now. I'm interested in humanitarian medicine. Could I give this as an answer to what makes you stand out, or is it too specific? No, you can do. That's quite a good answer, I think. It doesn't show that you're closed-minded. It just shows that you have thought about something in a bit more depth. You can say, I understand that when I come to medicine, I will explore other medical specialties as well. But at the moment, this is what's most interesting to me, and this is what I want to pursue. There's nothing wrong with saying that. How long should you answer? Should your answer to why medicine be? Well, it depends on how much time you have. To be honest, you can talk for ages about why you want to study medicine and things like that. You can give lots of different examples, and you can also talk about current NHS issues. But usually it's 5 minutes per station, so just aim for that. Can you share the slides or link to the last meeting? I can't share the slides directly to you guys, but one of the six, if you on your group chat, if you ask one of the 6med admin to share it with you, they should be able to share it. How long are the MMI stations? Like I said, 5 to 6 minutes per station. Do you enjoy medicine right now? Yes. So I'm in my 4th year, technically 5th year, because I've done 3 years of medicine. Then last year I took a 1 year to do my intercalation, and then I've come back to medicine. So I'm in 4th year of medicine, but in total I've been at uni for 5 years. I think I prefer 3rd year, 4th year and 5th year to 1st and 2nd year, because 1st and 2nd year is just a lot of lectures and being talked at, whereas once you start 3rd, 4th and 5th year, you actually see patients every day and you're in the hospital all the time, and I prefer learning from patients than from a textbook, so I really enjoy it. How can we get an invite into the group chat for 6med? I think someone should be able to share a link, hopefully. I'm not too sure, so if somebody else has the link for that, please share it in chat. There is a 6med group chat for different entries, so like 2023 entry, 2024 entry. So if somebody can add you guys, just talk between yourselves. What did I intercalate in? I intercalated in medical sciences with endocrinology in Imperial. So I went outside of my university. So my normal uni is Bristol, but I took I externally intercalated in Imperial because I really liked the course there. So endocrinology is everything to do with hormones. So like your pituitary axis, hypothalamus, then reproductive organs, your adrenal glands, kidneys, all of that stuff. So stuff like diabetes, cancers, which have endocrine side effects and stuff like that. So that's what I did mine in. What's your opinion on case-based learning? I think it's a really good way to learn. That's what Bristol offers. It just gives like students a more active role in their learning, and I just really enjoy it. I prefer that to sitting in a lecture theatre and being talked at, because I just tend to tune out after a while unless it's an interesting topic, whereas in CBL, when you're given a case about a patient, you're actively working through it, and I think it's the best way to learn. What extracurriculars did you do? Well, before I started medicine, it was things like I played the piano, played tennis, and I think that's about, and then reading. I really enjoyed reading and things like that. And then when I got into university, didn't have as much time to do things like reading, but I do a lot of running, so physical activity and going to the gym and things like that. So that's kind of where it's moved. So my hobbies have changed slightly, but I still enjoy the things I used to do as well. What did you think of Imperial Medical School itself? Any downsides? I don't think there were any downsides. Very good university. If you want to get involved in research, it's the place to be. If it's very competitive. Not to get in, it is competitive to get in, but also, I mean, within the medical school itself, there is a lot of competition. So it can be a high stress environment, but only if you make it that way. So if you're the type of person who thinks, I just am happy to, do my best, but I don't want to be like getting 100% every time, you'll be fine. But if you're one of those people who, very high achievers kind of thing, it can sometimes become a high stress environment, but obviously university is what you make it to be. No downsides, I don't think. It's in London, it's got everything you need, it's got like the best lecturers, so I think it's a great place to go. I don't have any negatives about that uni at all. Are you a grad entry med student? No, I got in directly after A-levels. So I'm not a grad student, but I have taught a few grad students and helped them get into medicine. Would you say it's better to integrate into a medical related topic or just any? Doesn't really matter. It's, to be honest, the only way you're going to do well in your intercalation is if you choose a degree which you like, not something that's going to, make you look good. You have to enjoy it in order to be able to do that for a whole year, because it is stressful and you have to write a dissertation on it. So 10,000 words or 5,000 words on related to that degree that you're doing at the end. The only way you're going to get through that is if you actually enjoy what you're studying. If you don't enjoy it, you're not going to do well. So that's just general advice for anything. So don't just apply for something because you think it's going to look good on your CV. Do it because you actually enjoy it. Is Leicester Medicine competitive course? I think all medical courses are competitive. I don't know anything specific about Leicester because I haven't applied, and I don't know a lot of people who have personally. I know people in general have applied to it. I just don't know anyone, so I can't tell you much about it. Would you say extracurriculars are weighted heavily? Not necessarily, but obviously it's good to have extracurriculars because you need to de-stress in some way. Why is there competition within medical school if Imperial itself? It's just within the year, like you get ranked as well of like how well you do, and that's in every medical school. In Imperial, I think just some students take it a bit more seriously, is what my experience has been, but it might not be the case for some other people. So yeah. How do you think research opportunities differ between Bristol and Imperial? Well, in Imperial, endocrinology, which is the course I studied, was very well taught, and they had like some of the best researchers there, which is why I wanted to go there, because I thought I'd learn, the most up and coming research. Bristol do slightly different research. Bristol has the biggest heart institute in the country. So if you're interested in cardiology and things like that, that's where you should go for research, because they do a master's, MRes, which is a master's in research with cardiovascular sciences or in renal sciences. So they specialize in those. So different universities specialize in different things, and it's really about what you're interested in. That's where you should go. Could they ask about a specific case that's particularly big in medicine, or would they more likely ask about a current affair? A current affair you've read on is probably most likely. Could they ask how COVID-19 affects the body? They could do, so read up on things like long COVID syndrome. Do you know any unis which like cancer research? Bristol is a big one. Liverpool is a big one. I can't think of anything else off the top of my head, but have a look online. So I'll just take a few more questions and then we'll end. Did you like doing the intercalated degree? Yeah, I really enjoyed it. It was a year out of medicine for me, which was the perfect time because third year was very stressful. So intercalation was slightly different in that we didn't need to, there wasn't as much teaching that you had, but it was a lot more self-directed learning. So it was a different kind of stress where you had to keep on top of your coursework, and it was a lot of essay writing, a lot of research skills that we hadn't been taught in medicine that we had to learn in intercalation. But I enjoyed it because I'm quite passionate about writing essays and things like that. I mean, I did English literature for A-level, so I just generally enjoy writing essays and stuff like that. Some people don't like that sort of stuff, so they chose intercalations where there wasn't as much research and just more written exams. So yeah, you can weigh it up when you come into medicine. Should you mention you're a grad student in MMI stations? You can do, and you can talk about why after you've graduated you've considered medicine. I think that's relevant. How much scientific knowledge can be asked in an MMI? Basically, like your GCSE A-level biology level knowledge. If you're going to Oxford or Cambridge, they can ask you a few niche questions, and they might give you a problem and they might just ask you to talk through how you'll solve it, like in chemistry, or like a biology question they could ask, which you may not necessarily know the answer to, but they just expect you to show you're working out, even if you don't get the answer. Was it hard to go back to medicine after intercalating? A lot of people ask me this. I was worried about this as well, but I don't think it was as difficult as people make it out to be. I think people over exaggerate a little bit. You're still going to remember everything you learned in third year. It's not like you've taken 5 years out, it's just 1 year, and that's not long enough for you to forget things. And also you're intercalating in a relatively medical related topic, so you're not going to forget everything. It's very difficult to forget stuff. So maybe like 2 to 3 weeks to settle back into medicine. But I don't think it's difficult at all. Would you suggest take a paid session for an interview? Or actually, if we read all about topics, we can still ace it. It's personal preference. I'm not going to give my opinion on that. I went to one course, which was a Kaplan course, and I found that useful, and then after that I just practiced at home. But if you feel like you found enough knowledge, if you found enough information on the internet and you're happy, you feel confident enough with that, I'd go with that. The only reason I would say a course is good is because you get feedback from people like me, like medical students or doctors who have been through it and they've done lots of interviews, so they know what to expect. So you'll get that feedback. So maybe going to one course could benefit, but again, it's up to you. And also you have to take into account the cost. It might be a bit expensive. So like think about those things as well. If we're a grad student only decide that we'd want to study medicine recently, would this be a detriment? No. I don't think so. You just need to show your dedication through your work experience. Did you feel confident after your interviews? No. I was very nervous and I thought I did really badly, but I still got the offers. So it's just, I think sometimes we're a bit too hard on ourselves. So yeah, I don't know, it can vary, but I thought I didn't get in, but then I did get in. So yeah. Does 6med do a free mock interview at all? I'm not too sure. That question might be better asked on to like an actual 6med person. I'm just one of the people like employed by them. I'm not one of the admin people, so it's better off asking them instead of me. How do you manage stress and anxiety that comes with the demands of the course? You just take it chunk by chunk. Try not to focus on loads of things at the same time, and just make sure that you set aside time to relax, even if you're having a stressful week. Yeah, I think that's it. So we'll end the session there. Thanks everyone for participating today. And probably I think someone else is leading next week's surgery, but hopefully you guys feel a little bit more confident later on and you all do well in your interviews. So I wish all of you the best for that.